NREMT Certification 2026 Emergency Medical Technicians Exam Tips. All you need to know. Question 1. A patient is found unresponsive with snoring respirations. Your first action should be: start CPR, perform a head tilt/chin lift, apply oxygen, suction the airway. Snoring usually indicates tongue obstruction. Opening the airway is first. Question 2. What is the normal respiratory rate for an adult at rest? 8 to 12 bpm, 12 to 20 bpm, 20 to 30 bpm, 10 to 15 bpm. 12 to 20 is the standard normal range. Question 3. Which heart rhythm is shockable by an AED? Asystole, ventricular fibrillation, P. Normal sinus rhythm. AEDs shock VFib and pulseless VTach. Question 4. A 65-year-old male complains of chest pain and shortness of breath. You should suspect asthma, myocardial infarction, anaphylaxis, pneumonia. Chest pain in seniors is often cardiac until proven otherwise. Question 5. What is the first step in the primary assessment? Check pulse, form a general impression, check airway, determine lock. Assessment begins with a general impression as you approach. Question 6. True or false, a tourniquet should be tightened until the distal pulse disappears. True, false. The goal of a tourniquet is to stop all arterial flow. Question 7. A patient has a capillary refill time of 4 seconds. This is considered normal, delayed, rapid, insignificant. Normal refill is under 2 seconds. Question 8. Which of these is a sign of compensated shock? Low blood pressure, tachycardia, decreased lock, weak pulse. In compensated shock, the body increases heart rate to maintain pressure. Question 9. The G in GCS stands for General, Glasgow, Grading, Geriatric. Glasgow Coma Scale. Question 10. What is the dose for an adult EpiPen? 0.15 mg, 0.3 mg, 0.5 mg, 1 mg. Adult dose is 0.3 mg, pediatric is 0.15 mg. Question 11. When suctioning an adult, the maximum time per attempt is 5 seconds, 10 seconds, 15 seconds, 30 seconds. Limit to 15 seconds to prevent hypoxia. Question 12. A patient with an impaled object in the leg should have it removed immediately, stabilized in place, pushed in further, cut shorter. Never remove an impaled object unless it blocks the airway. Question 13. Which law protects EMS providers from liability when acting in good faith? Miranda Law, Good Samaritan Law, Hippocratic Oath, First Responder Act. Good Samaritan laws provide limited immunity. Question 14. What is the compression to ventilation ratio for one rescuer adult CPR? 15:2, 30:2, 5:1, 30:1. 30 compressions to 2 breaths. Question 15. Cyanosis indicates which of the following? High oxygen levels, hypoxia, hyperglycemia, internal bleeding. Blue tint to skin suggests lack of oxygen. Question 16. A stoma is an opening in the abdomen, neck, chest, skull. A tracheostomy stoma is in the neck. Question 17. The focused assessment for a trauma patient with a significant MOA should be head to toe, focused on the injury, deferred, Vitals only. Significant MOA requires a rapid full-body scan. Question 18. Nitroglycerin is contraindicated if the patient's systolic BP is below 120, 100, 90, 110. Standard protocol avoids nitro if systolic BP 90 to 100. Question 19. An OPA is used for a patient who is conscious, has a gag reflex, is unconscious without a gag reflex, has a broken jaw. OPA is only for those without a gag reflex. Question 20. What is the golden hour in trauma? The first hour of surgery, the first hour after injury, the time it takes to get to the ER, the first hour of rehab. Refers to the critical first hour where survival is highest.